And this was very, very, very nice. And talking about the history, we can understand that the history of endoscopy starts here in Frankfurt. And this is the Frankfurt Cathedral, and the Frankfurt Cathedral was actually destroyed after World War II. And while they were rebuilding the cathedral, they found the graveyard of this doctor, Dr. Filippo Bozzini. He has this Italian back name, but he was actually born in Germany. And he died with 36 years old, but he was a visionary. He was the first one who tried to look the inside of our organs with using an endoscope. And this was the first endoscope that he created. He put a candle here, the smoke came through here, he put his eye here, and inserted this into the urethra or into the anus of the patients to try to examine. And history repeats itself. It's very fun. When endoscopes were shown to ENTs for the first time, this is the California Medical Journal of 1904, they said, okay, endoscopes are interesting gadgets. Remember when balloon was presented to the ENTs, they showed, okay, balloons are interesting gadgets. So history repeats itself. But the history of light and the history of our specialty changed by this guy, Manuel Garcia. He was walking in the Paris Louvre Museum in the summertime, and he saw the sun reflected in the mirrors of the Louvre. And then he was a teaching singer, and then he thought about, I'm going to a dentist shop and I'm going to buy a mirror to try to see my own vocal cords, to put light in my own vocal cords to understand the physiology of it. So he presented this to the Royal London Academy of Medicine, and they said, oh, you're crazy, this is a gadget. But he was actually the oldest medical student ever, because he died with 101 years old. When he was 100 years, the French gave him a title of honorary medical doctor because of his invention. And if you think about, for many, many years, the symbol of ENT was the frontal mirror and the Garcia mirror. This was the symbol of our specialty. And the name is the conjunction of otology, who had the anatomical and physiological knowledge, and laryngology, who had the capability and the ability to bring light to it. But in Berlin, in Germany, the history changed again because of this doctor, Dr. Killian. He was one of the first to examine the nasal cavity with the endoscope, and he could define some new pathologies, just like the Killian pollen. And this is the posterity picture of the Berlin department, ENT department. This is Dr. Killian, all the professors. Although he used the endoscope for the posterity, he is not showing the endoscope. It was a gadget, it was a blasphemy. He is showing the frontal mirror. The endoscope was used by Dr. Messer-Klinger in Graz, and Dr. Messer-Klinger could examine, could understand the physiology, because the endoscope could give a better light, a better more understanding of the anatomy. But this is also the posterity picture of Dr. Messer-Klinger using the endoscope, but not abandoning the frontal mirror. This was the symbol of ENT. And Dr. Sternberger was actually the first one for the posterity picture, only the endoscope. He was trying to get the message. Now ENTs are endoscopic surgeons. And even we use the endoscope in the sinus cavity for many, many years, we still don't understand the physiology, don't understand the anatomy, don't understand, as you can see, the